Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
I've been asked recently several times in consultation from healthcare practitioners, why are folks still having low vitamin D levels? I'm giving them vitamin D and I think it's a good source. Well, there are several issues, so let's talk about them. Malabsorption issue conditions such as celiac disease, Crohn's disease, pancreatic insufficiency can impair the absorption of vitamin D in the intestines. Additionally, surgeries that affect gastrointestinal tract like bypass will also lead to malabsorption. Medication interactions, because several of them can interfere with vitamin D metabolism. For example, anticonvulsants like phenytoin and phenobarbital, glucocorticoids, and some weight loss drugs can reduce vitamin D levels by increasing its breakdown or altering its absorption. Liver or kidney dysfunction, vitamin D undergoes conversion in the liver and kidneys to an active form. Liver disease or chronic kidney disease will impair the conversion process and leads to lower levels of active vitamin D despite adequate supplementation. Obesity, vitamin D is a fat-soluble vitamin and it stores in the body fat. In individuals with obesity, vitamin D may become trapped in the adipose tissue, reducing its bioavailability in the bloodstream. And there are genetic factors. Certain genetic variation can affect vitamin D metabolism, receptor activity. This leads to lower levels, even with supplementation as well. And there are polymorphisms that will change the binding to the vitamin D receptor. Now, inadequate dosage or poor quality supplements, yes, the dosage might be not sufficient for the needs or the supplement may not be of high quality. Making sure you check for the D2 versus the D3, that's what you want, form is important. If you store in excessive heat, it can reduce the supplement's particular efficacy. And polymorphism, to go back to that, like low VDR, someone has vitamin D receptor disorder, it is more dysfunctional. The treatment approach, you have to address not only the vitamin D level, but how the body utilizes it. One strategy involves using active vitamin D analogs because vitamin D3 cholecalciferol can be converted into the liver and kidneys in its active form calcitriol before binding to the receptor. And a receptor disorder can blunt this process. Now, if you administer an active form of vitamin D, such as calcitriol or 1-alpha hydroxy vitamin D, it can bypass some of these metabolic steps and pretty much may help. Another important approach is to optimize calcium levels through higher dose calcium supplementation and dietary adjustments. Vitamin D facilitates intestinal calcium absorptions. Patients with a VDR receptor dysfunction are often experience low calcium levels in oral supplements. In more severe case, sometimes even intravenous supplementation may be required. For instances, combining vitamin D analogs with calcium supplementation provides a more effective strategy than using one or the other itself. Ultimately, each patient's situation and the specifics of their VDR defect, well, it's going to require an individual treatment plan that may involve a multidisciplinary team to look at to make sure that this works and make sure that you maximize the downstream benefits of vitamin D and mitigate the clinical consequences of a VDR receptor disorder. And of course, there's always non-compliance of patients. I didn't want to leave it out. And they may not be taking their supplements as prescribed, either due to forgetfulness, misunderstanding the instructions, or experiencing side effects, or they just don't want to use it. You know how that goes. Increased needs for certain conditions like pregnancy, chronic illness, increases the body's demand for vitamin D and necessitates higher doses than usual. Let me give you the summary of this. Since vitamin D is fat-soluble, ensure that the supplements are pretty much taken with meals, particularly with healthy fats. For example, incorporate foods like olive oil, avocado, nuts. A full-fat dairy can promote the formation of micelles, which are essential for absorbing fat-soluble vitamins in the gut. Magnesium plays an important role in the activation and metabolism of vitamin D. So adequate intakes of magnesium, and you can use leafy greens, nuts, seeds, legumes, whole grains, that may help. While calcium itself doesn't boost the vitamin D absorption directly, but maintaining a balanced calcium intake is important because vitamin D enhances calcium absorption in the gut, and they work together to support the bone health. Including calcium-rich foods in the diet, dairy, fortified alternatives, well, it's beneficial. And vitamin K2, of course, the nutrient that works synergistically with vitamin D to help calcium deposition. It ensures it goes to the bones rather than the soft tissues. Foods like fermented soy, natto, particularly certain cheeses, and other fermented products can be good sources of vitamin K2 or supplementation, of course. A healthy gut environment is key to optimal absorption of all nutrients. Make sure you have fermented foods, probiotics, of course, to help the digestive health. And finally, if there are any underlying gastrointestinal issues like malabsorption syndromes or conditions like celiac, you need to address these with the appropriate medical treatment if you want to make sure your vitamins, especially soluble vitamins like vitamin D, to be taken in properly. Optimizing gut health can significantly improve how well vitamin D and other nutrients are absorbed. Hope this helps you with determining how to help your patients even though you're supplementing and they're still showing in blood tests low vitamin D levels. Thanks so much for watching.